Thank you, Mr. Chairman. And just to follow up on that point here, you know, we know the numbers. We know that Native Americans, Alaska Natives, as a population demographically, are dying in the past 2 years of drug overdoses more than any other populations out there. We just had a hearing in appropriations this morning on an emergency supplemental. This was the domestic. We talked about the border. Several of my colleagues were there at committee. We talked about fentanyl, and there is a significant increase in a significant provision in the supplemental to combat fentanyl. There's $250 million directed to IHS. I'm looking at the situation in Indian country. I'm looking at the situation in, again, communities like Tyonek, Savunga, Dillingham, tiny little native communities that are so far off the grid, most people don't even know that they exist. And yet the drugs are coming in and they are killing people. And so we need this data. We need to understand how it is moving so rapidly. I think we all recognize that we've got to be doing more when it comes to treatment, but we're dealing with a drug, the lethality of which is almost incomprehensible for most people. And so when we talk about treatment facilities, you just can't take your standard 5-week treatment facility and get somebody who is addicted to fentanyl and somebody who got addicted in less than a month and think that in 5 weeks you're going to flip this and you're going to have somebody that's now clean. We've got a challenge that is so big and so enormous, it's going to take exactly what you all are doing in your Lummi Nation, Chairman, with saying as a community, we've got to wrap our arms around it. We pretty much have to figure out how we do this from within. And so I know that resources will be a challenge. I would ask the three of you as tribal leaders, knowing that IHS is going to be receiving a specific increment to go towards these services, where would you specifically direct that? And give that to us in writing. I think that would be helpful for us. I want to ask Mr. Geddes about what you've been able to do. You have established these 3 different opioid treatment programs. You've got them in Juneau, you've got them in Sitka, now Klawock. We know that for far too many of our communities, whether you're islanded like you are in Southeast or in many parts of Indian country where the distances are just so great, that telehealth is really one way where we can make a difference. Can you describe how the Telehealth Authority has helped to improve treatment for patients who aren't able to get to it, but also speak to the stigma part of it? Because I'm hearing more and more and more that people, they don't want to go into the behavioral health clinic because they're going to get tagged as that guy's got a problem. We all know what it is. Don't want to even be seen in there. But through telehealth, it gives you that level of anonymity that might help address the stigmas. So, Mr. Geddes, can you speak to that, please?
Thank you, Senator Murkowski. Yes, as you pointed out, Southeast Alaska is a group of islands, spans 600 miles, very, very small native communities throughout the region, and much of Alaska is the same way. With the advancement and availability of telehealth services, we've been able to create follow-up aftercare programs, because once you enter into a service and maybe work on sobriety or abstaining, then you return home, because people need to be part of their communities. They need to be part of their families and need to have that family kinship. Being able to return home and then participate in an aftercare program is just essential. And telehealth has been a big component of that. Not only has it allowed people to enter into conversations by phone or by a Teams meeting or some sort of video like this, but you can then do that without stepping into sometimes the that stigmatizing treatment facility that doesn't fit for everyone. So we've been able to see significant gains around with telehealth access. It's particularly valuable here throughout our expansive region. We have seasonal workers who need to go fishing, who need to go hunting, who need to be out, and then but with telehealth we can bring that in. We've also seen, and I don't want this lost. I've heard from communities across Alaska that elders also have an improved ability for any sort of telehealth access. It improves healthcare, it improves and reduces disparities. So I strongly support remaining and keeping telehealth opportunities as available as possible.
Thank you. Um, just to our panelists, know that we've been in a series of votes. So when you see us popping up and down, it's not because we're not being attentive. It's because we do have to go over and vote. That's where the chairman is now, and that's where I will be going when he comes back, but not for lack of attention. Senator Tester.